Well, that worked better than it did last time. Good afternoon. I'm Greg Foster, Emergency Management Director for Nassau County. First, it's Thanksgiving, so let me say to all the residents of Nassau County, Happy Thanksgiving. I hope you and your family and your friends are safe and practicing infection control guidelines that you've heard from us for months now. Keep gathering small. That's especially important during this holiday season. Practice social distancing. Wear a mask in public places and wash your hands frequently. I also want to point out a couple of changes that we've instituted recently on our social media messaging platforms. First, we have created a new web page where we have posted a lot of information that we hope that you will find helpful, not just about COVID-19, but phone numbers, events, guides, and much more. That is www.onenassau.com. That is One Nassau, O-N-E, Nassau.com. You'll also find that we are posting more information on Nextdoor and Instagram. And in addition to our Facebook page, we have a Nassau EM group for our daily COVID-19 summary updates. And I would like to repeat our vision and mission here in emergency management. Our vision is a county that is aware, prepared, and resilient to all hazards. Our mission is helping the whole community before, during, and after disasters. Now, joining me for our fourth segment is Dave Richardson, our PIO here at EOC. Dave.
Happy Thanksgiving, Director.
Happy Thanksgiving to you.
Good to see you. Let's talk briefly, if we may, about the timeline for COVID-19 vaccines. Who will get it first? When will it be available to the general public? And I guess most importantly, can we be confident it will be safe and effective?
Sure. That's a great question. The information that we're getting in emergency management is much like the information that's coming out over the national media, coming out of the White House and the Operation Warp Speed people, is that vaccines should be available by the end of this calendar year or the beginning of next year. There are several companies that are working on it. They might come out at different times, but we're expecting a vaccine to be done by the end of this calendar year or beginning of next year. That will be made available to the healthcare workers, the frontline healthcare workers, first responders, be it fire rescue, EMT, or police first. Then it would be given to the most vulnerable of our population, being the people that have pre-existing conditions or are at an age that makes them more vulnerable to the virus. And finally, there will be it will be made available to the general public probably the middle of next year, probably about 6 months after the initial batch comes out. But all those are estimates on time. There's no way to know until we get a little bit closer when that will be. In reference to whether it's going to be safe and effective, we are very lucky in America to have the FDA. The FDA tests all this for safety, tests it all for effectiveness. They run it through a course of their own testing to make sure that it's not going to harm people and that it's going to be effective. So when the FDA comes out and approves it and says it's good for use, I'm confident that it's safe and good for use.
So there are several companies that are going to be distributing the vaccine. How do we in the general public know which vaccine we're going to get? Or do we get to choose which vaccine? How does that work?
It's going to be based on who's being offered the vaccine when the vaccine comes out. Those decisions are going to be made at the national level. The CDC and Health and Human Services have contracts with service providers to bring those vaccines out to the local level and state level. So it's going to be what's available at that time. But all the vaccines go through the same verification process through FDA. So if you do get one from a company that the original ones weren't from, you can feel confident that it's going to be safe and effective.
Okay. I'd like to go back and ask a question about the protocols of isolation, quarantining, how long, when you either show symptoms or you're not showing symptoms, you've been exposed to someone. What process? Because I think there's a little bit of confusion sometimes about, should I take a test? I was exposed today. Should I go take a test tomorrow? Outline the protocols for us about about that process.
And that's kind of changed over time as the scientists, as the doctors learn more about this virus. Some of that information's changed. So the most current information is that if you test positive, if you go in and get the test and test positive, you're to isolate for 10 days. And that's based on the fact that there's a certain period of time that the virus germinates in your body, that you were exposed, you had it, but it's not going to show up if you go in and take a test, or there's a likelihood it won't show up. So they give about 4 days for it to germinate in your body and get to that point where it will show up in the test, which is that total of 14 days. 4 days prior to, you take the test, 10 days after gives you that 14 days. If you've been exposed to somebody who is positive and that you believe that you were exposed to them, then it's going to be a 14-day quarantine. Both of those are based on the symptoms getting better, not completely going away, but getting better, and then going through a 24-hour process of not having a fever. And that's not taking Motrin or Tylenol or another fever reducer. That's, okay, I'm just sitting here at home, haven't taken any kind of medication, and I've gone 24 hours without a fever of 100.7. If you feel like you've been exposed to somebody who is COVID-19 positive, or you know that you've been exposed to somebody that is COVID-19 positive, there is that time period when you've been exposed and you may have gotten it. You may have actually contracted the virus, but you're not going to show up on a test because it hasn't gone through its total process. So the estimate is somewhere between 3 and 5 days, with 4 days being in the middle, that you're going to show up positive on a test. So if you feel like you've been exposed, you've come in contact with somebody who is COVID-19 positive, it's better safe than sorry. You need to quarantine. You need to keep away from large groups. You need to keep away from your loved ones. Give it that time period to make sure that if you are going to show positive, it's had the time to germinate in your body. Then if you want to go get tested, that 4 or 5 day periods when you want to go out and get tested.
And you may have a copy of the graphic that we've posted.
Sure.
That explains that as well.
Absolutely.
About what the FDOH recommends.
Absolutely.
Right. So
we have this on our website. We have a post on our website, and it's kind of good that we're speaking about this because it has come up recently with FDOH that because we are a rural suburb county of the city of Jacksonville, that sometimes there's a time delay from some of the testing sites before it gets to our health department, so that our epidemiologists and contact tracers can reach out to the people that are positive. So what we're asking is, if you go to a testing site outside of Nassau County and you come back with a positive test, there's a few things that you need to do. Number one, you need to isolate for 10 days, and that's to prevent the spread that we're obviously seeing surge right now, help prevent that spread. Also, you need to contact the people that you have come in contact with since the point that you feel like you contracted it. And most of the time we can walk back and figure out how we contracted it and let them know, hey, I've tested positive. You may want to quarantine and go get tested to see if you're positive or not. You're going to be provided either through a website, an email, or in person. You're going to be provided with documentation saying, I am in fact positive for COVID-19. We need you to reach out to the Nassau County Department of Health, provide them with the information that I've been tested positive at this site. Here is the documentation for that, so they can walk through their process of counting you, doing the contact tracing, reaching out to the people that may have been infected by you. Now, if you get tested in Nassau County, it's pretty robust. It's a pretty quick return on that to the Department of Health. So we're really focusing on that out of county, Duval County. If you go to Regency Square Mall or one of the other testing places and you come back with a positive test, go ahead and isolate, contact your people that you're around all the time, and reach out to the Florida Department of Health, Nassau County, so that they will know.
Okay, great. Director, thank you. Happy Thanksgiving again.
Happy Thanksgiving to you.
And we'll see you again next week.
Yes, sir.